my name is Jessica Mason, and today I'm going to present my passion project for Nursing 212. So I did my passion project on trauma nursing. I've worked in trauma for a couple years now, and it really sparked an interest in me. So my inspiration for doing my project on trauma nursing, as I mentioned before, I have been working in a trauma ICU setting for a couple years now, and it really increased my experience in the field and my interest in trauma. I enjoy that it's very complex and there's multiple teams that have to be involved in the care, and I really enjoy the aspect of having to work with a lot of different teams to provide good care to the patients. There's a bunch of excitement when it comes to trauma nursing, whether it be people who have really traumatic wounds, moving at a very fast pace. It's just a really exciting environment. And I like to make a difference in my patients' lives. I think that trauma is a very good field to be able to make differences in people's lives and families and everyone involved. So for education requirements to become a trauma nurse, obviously you have your basic education. You have to obtain a 2-year associate degree or a 4-year bachelor's degree in nursing. Then you have to pass the NCLEX examination to make sure your license is valid. Other certifications that are desired but not required to be in the field of trauma nursing is the TCRN, or Trauma Certified Registered Nurse. You can also get your CEN, which is Certified Emergency Nurse. There's Critical Care Registered Nurse, which would be needed for, say, if you were working in a trauma ICU. And then Advanced Life Support, or ALS, is very desirable when it comes to trauma nursing because there's a lot of code situations. And then it says, in order to obtain additional trauma and emergency care certifications, you have to have at least 2 years or around 1,000 hours of experience and 20 to 30 hours of trauma-specific coursework, which would be like continuing education courses. So knowledge and experience required for a trauma nurse. Trauma nurses have to be knowledgeable in a variety of different areas. Some things that trauma nurses do are triage patients in order of the acuity. They need to recognize signs and symptoms of deterioration. They should know how to administer life-saving medications, blood products, wound care. They need to have good communication skills so that they can effectively communicate with other members of the team. And they need to be able to provide education to the patients and their families about continuing care. Trauma nurses also need to be up to date on evidence-based practice and safety goals and facility protocols and regulations. And then there's not actually any definitive experience requirements that you have to have prior to entering the trauma field, but it is recommended that you have experience so that you can provide better care to your patients. So the role of a trauma nurse is very comprehensive. They deal with cases like motor vehicle accidents, assaults, stabbings, gunshot wounds, head injuries, really anything that causes harm to the body. It's the nurse's responsibility to be accurate and implement their interventions in a timely manner because a lot of times these patients don't have a lot of time left. So nurses need to be able to work quickly. They need to know how to apply a tourniquet, how to administer emergency medications, how to start CPR if needed. They also need to be able to provide education, resources, and emotional support to these patients and their families. So here's my timeline. In August 2020, I began the ADN program at Mitchell. And then May 2021 is when I will graduate with my ADN from Mitchell. Summer 2021 is when I'm planning to take the NCLEX and obtain my first nursing job, maybe not in trauma, but in a step-down unit or something to get some experience. May 2022 is when I'm on track to graduate with my BSN from Lenoir-Rhyne University. And then summer 2023 is when I plan to complete additional courses such as TCRN, CEN, and ACLS. And then in 2024 is when I plan to get a job as an actual trauma nurse, and preferably in an emergency or ICU setting. So here is my collage that I made of pictures that kind of represent trauma nursing to me. So the top picture here is a picture of nurses transporting a patient, and I like this picture because it really emphasizes the speed of a trauma nurse setting. You have to be very quick on your feet. This picture on the top right here is one of my favorites. It shows a nurse hugging a little boy in an ICU setting, and then the same nurse hugging the little boy after he's recovered. And that really represents to me what trauma nursing is. This picture on the left just represents the fast-paced setting and the weight of the situation. This picture here is just an emergency sign. Usually people who are victims of trauma, it is an emergency situation. The exercise your brain picture I really like because I think that trauma nurses really have to, use their resources and really their brain to problem solve and provide care to their patients. Here on the right is a picture of a car crash, and that just really signifies to me sometimes, the situations that patients get into that constitute them going to a trauma unit. Here on the bottom right is a picture of a room with a lot of blood on the floor, and this kind of represents to me the stress and the heaviness of being in a trauma setting and just sometimes what's left behind after a life has been saved. Here at the bottom is a picture of a healthcare team, and that really signifies to me the importance of comprehensive care and working with other team members in a trauma situation. And then this picture down here at the bottom is a nurse who is obviously tired and just maybe defeated. And I think that a lot of times trauma makes you feel that way. You can't save everybody, but obviously we try. Here on the bottom left is a picture of a trauma patient. He has a C-collar on and he's being bagged. This just really represents sometimes what a trauma setting looks like. And then right above that here is another picture that shows just the speed and the fast-paced setting. And then finally, here are my references. Thank you guys so much for watching.